So good morning, everyone. Sorry, good afternoon, everyone. My name's Shazia Khan, and the session we're doing today is effective communication in health and social care. And we're doing learning outcome today, but there's three learning outcomes and assignment discussion session that we'll be doing it. And there'll also be elements of the discussion around the assignment for the last session. So we'll have three learning outcomes and an assignment discussion session. And any sort of resources that you need to be going onto Moodle to get your resources, because that's where all your resources are available for you. Okay, I'll just show you the assignment before we carry on. But I'm just going to show you the assignment briefly because the assignment is available on Moodle for you. So once you go onto Moodle, you can get access to the assignment. All your resources are available on Moodle. And what we're going to do is let me just show you the assignment first before. So let me, can you, so this is the assignment. This is how the assignment brief looks. Can you all see that? Yeah?
Yeah.
Yes. Okay, excellent.
Mm.
So this is the assignment brief. This is how it looks, and you have a student declaration on it. It tells you about the assignment, the unit you're doing, the indicative content, how many word count, and then a declaration, which we're going to go through more later on towards the end, which is the fourth session. Okay, so this is the assignment. This is how it actually looks. And I'm just quickly going through it. So I'm not going to go through the questions. Yes, the learning outcomes are there, what is expected of you in each learning outcome. So we have learning outcome first, one which we'll be doing today, which is to understand the communication approaches used in health and social care. We'll be looking at 1.1, which is to explain the importance of effective communication in health and social care. We'll be looking at learning outcome 2, which is to understand the communication needs and preferences of individuals. In that learning outcome, we'll be looking at 2.1, which is to explain the importance of determining an individual's communication needs and preferences. 2.2, promote comparing and contrasting the approaches used when promoting effective communication. 2.3, to describe services and resources access to promote effective communication. We finally will look at learning outcome 3, which is to understand barriers to communication. We'll be looking at 3.1 to explain barriers to effective communication and 3.2 identify how to overcome these effective barriers. So this is again just standard tutors comments. This is all available on Moodle for you. Okay, so we're going to go through this when it comes to your final session, which is learning outcome 4. Okay, sorry, the assignment discussion session. So has anyone got any questions before we carry on with the slides? Okay, thank you. So the first session, like I said, is learning outcome 1, which is to understand the communication approaches used in health and social care. The indicative content we'll be looking at is the reasons for communication in health and social care. For example, expression of your needs, wants, social interaction, and the importance of effective health and social care. Why do you when you talk about communication, what is the first thing that comes to mind for anyone? Why is communication so important in any setting? Not just health and social care. Why is communication so important? Sorry?
Hello, good afternoon, everyone.
Hi, good afternoon, Latifa. Why is communication so important? Amy?
Hello, yeah, communication is important because you can know each other's problem
Okay.
and the patient can tell you what is problem and the doctor too or the nurse too can explain maybe the medication or the treatment to the patient.
Yes.
Yeah,
Yeah.
so
So
communication is
that's mainly
very
in
important. Yeah.
Latifa that's mainly in health and social care. Now, in the outside world, even communication is so important. If we look at it from a business perspective, for example, if you're going to a shop, it's so important to communicate what you want and how you want it. So, you know, in that kind of social setting, you know, communication is really important and it's part of day-to-day life. So we're going to look at understanding why communication is important. You know, it builds this element of trust. If you communicate with someone, you know, you're able to build this element of trust. You're able to, you know, be empathetic to that person. You're able to listen to that person and maintain any sort of confidentiality as well. You know, people learn differently and people listen differently as well. So, you know, important if you're trying to get a message across, is communication really important if someone's language is an issue? Nadij, do you think it's important? If someone struggles with the language skills, is communication important? Is there different types of communication you can communicate with that person?
Yeah.
Okay, is that Asma? Nadij, can
Oh,
you? No? Okay. Asma, what do you think?
so did you say if communication is important if there's like a language barrier?
Yeah, language barrier, because that's
Yeah.
really important in any
Yeah,
kind of,
yeah. Obviously, it's very important to communicate the needs of, for example, in a healthcare setting. So
yeah,
I've worked as an interpreter, and I see so many
yeah,
vulnerable patients
yeah,
that can't communicate, and
yes,
sometimes they can't even get an interpreter. So
yes,
it's really hard.
yeah,
It can also put a patient at risk of harm, or
yeah,
maybe they're going through something like abuse, or
yeah.
and if
And they
there's
can't say it really,
yeah, they
can they? They
can't
can't.
say it,
No.
and if there's like an interpreter to break that like language barrier, it's really
Yeah.
important for the effective communication.
Yeah, it is. And also sometimes, you know, like non-verbal things, you know, cues that they may say Asthma, you know, they may say their body language might come across
Yeah,
as, you know, quite, you know, quite reluctant to say things, especially if they've gone through, you know, issues of abuse or anything like that. So it's really, really important to get across, and communication has to be really effective. So you're listening to that person and able to understand, you know, not just, you know, turning your face and saying yes and no. You know, be attentive, listen to them. It's really, really important. Nancy, have you got anything to say?
I just says much about what she said really
Yeah,
because I work in a care sector as well, and
yes,
I see the way they struggle. Like
yes,
they want to say something, or some of them they can't even say anything at all.
yes,
But the
yes,
body language is it's just talking to you. But
yes.
yeah.
It's difficult, but that's why, you know, communication is really important. You know, you know, the next slide says what are reasons for communication. If you can't communicate with anyone, then you can't inform that person of what's going on. You know, if
Yeah.
you're in pain, especially in health and social care sector, you know, you can't tell that person I'm in pain. You can maybe just touch your stomach to do like non-verbal cues, but otherwise, if you can't, if you have issues with language, then it's going to be really hard. Also, communication is also important for someone to express their feelings, how they're feeling, you know, how they're connecting with someone and how they are, you know, able to take any sort of actions or advice or anything. So in health and social care, you know, you have to communicate with different people from different, you know, backgrounds. So it might be doctors, it might be nurses, it may be your colleagues, it may be agencies outside. It may be your colleagues at work, maybe other nurses, maybe other radiotherapists, or maybe, you know, families of the carers, you know, or carers of the patient or the individual who's there, the patient themselves, or maybe an advocate, their friends, or anyone. So you have to communicate with them. So you need to build this relationship of communication to make sure you connect with that person and you're able to, you know, communicate any sort of elements of, you know, the maybe the person's illnesses or medication or anything like that. So it's really, really important in health and social care, especially. So what are the main reasons why people communicate? You know, people communicate because they need to get information from people or they need to give information. For example, if you're in a setting where, you know, you are with the patient and you are trying to tell the patient about new medication or anything, then you have to give information to that person. So why is communication important then? If you have to tell patient about any sort of new medication, why do you think it's really important that it's communicated right?
So are you asking if why it's important
Yes, yeah,
when a doctor like talks about new
yeah,
medication?
yeah,
Obviously, the doses is very important to let the patient know how much they actually need to take because they could take more than they need to
yeah,
and put themselves at risk of harm. Also like taking it what time a day, and I think that's the main points.
yeah.
Education.
And they also understand what the medications for asthma, if some
Yeah,
patients don't understand, culturally, some patients have issues understanding,
yeah,
what certain things mean, but, you need to use simple language for some
yeah,
people
yeah.
and
I
not
was also,
avoid using
yeah,
like, medical jargon because they don't understand that. And if you speak clearly to them, make sure they get the message across that this is the new medication, this is the impact of it, this is what it's for, these are the side effects. You are conveying information to that person, and you need to make sure that you are that the person understands. By doing this, you're making that person understand, but also, like you said, you need the use of interpreters to help them if there's language barriers to ensure that they understand everything. And obviously, you need to be patient because if someone struggles to understand anything, you need to be the one who's patient and take on board what they're saying. Nancy, what do you think? Why do you think? What are the main reasons why people communicate?
Uh, some reasons, like in a care sector or the doctors,
Yeah.
like it's important because it helps to keep the records
Yes.
of what they have or what they are supposed to do before or after the medications,
Yes.
or the doctors to communicate with the nurses in the care sector to explain to them or to tell them how the medication it should be
Yeah.
taken or
So
how
it's
to
not just
keep it.
it's not just
Yeah.
working with the patients, it's working with other colleagues, other doctors, interacting with other people outside as well. Having this person-centered care, which means that individuals, are equals in planning and monitoring their own care plans. So making sure they're able to understand what they're doing. Because it's
Yeah.
difficult sometimes for a patient to understand, especially if they're elderly and especially if they have language barriers as well, or if they have any sort of mental illnesses or any disabilities that, prevents them from kind of understanding properly. So, you have to be clear. You need to make sure they understand. Need to make sure you are giving correct information and not using language that is, they can't understand. So effective communication, effective is important in person-centered social care. So, we have different effective listening techniques and, why is it important to make sure that the individual knows that you're listening to them? Why do you think that is so important? Sometimes people will sit there and they would roll their eyes. Um, Muganazi, why do you think that's so important? Is it Mugaranazi? Okay. Amy? Amy, why do you think it's so important to be attentively listening to that person?
It will make the person comfortable and
Yes.
trust you to talk to you freely.
Yeah. And also, do you think that these approaches that we're listening to them is, it makes them feel that they can trust us?
Yes.
Yeah. Because if you start rolling your eyes, does that impact on, oh my God, I'm bored, or yawning and things like that? Will the person feel, that you are listening to them?
No.
No,
No,
and
no.
they will think you may judge them.
Yes, yes.
Well, yeah.
Yeah, so effective listening is really important because you need to make sure you are fully present and able to, and attentive to the speaker. You need to be supportive. You need to give eye contact and, when they're telling you something, nod, but also give, feedback to them. And, avoid, like you said, Mugarazi, judgment. They don't want to be judged. They want you to foster this comfortable environment, so that they can speak freely. You know, everyone wants to be comfortable and be able to, you know, speak freely and be able to open up. And
Yeah.
you have to give your undivided attention to that person, you know, speak to them. Make sure that you are putting, you know, any sort of distractions out of the way. So if you have a mobile phone, make sure you're not looking at the mobile phone. You know, they need that support to, you know, identify their needs or anything. And individuals need to feel that they are being listened to rather than, you know, us rolling our eyes or, you know, being judgmental. Make sure you are listening. Make sure you are fostering this technique of where, you know, you are asking, you know, your body language is quite good for them, you know, because sometimes people feel that, you know, the body language is not good as well, you know, so it's really important. So what I'll do now is I'm going to put this video on for you. Just tell me if you can see this video and if you can hear it as well. Actually, can you hear this? Can you hear this?
Mm.
Can you hear the video, Nancy?
No.
Not really. I'm just waiting to see if I can.
Or is it not come up? Let me just take
Yeah.
just 1 minute. I'll just show you the video now. But I'm just having a look where it could share sound. Okay. So let's see. Can you see it now, everyone?
It's...
Can you hear?
Yeah. We can. Yeah.
Just watch this video. It's about communication. It's quite interesting.
Yeah.
Effective communication helps you to build good relationships with the individuals you support, their friends and family, as well as colleagues and outside agencies. Good communication skills will help you to develop effective working relationships, give and receive information about the care and support you deliver, provide emotional support to the people you work with, and carry out an assessment of an individual's care needs. As a care worker, you communicate in a variety of ways. Verbal communication, including the volume, speed, tone and pitch of your voice. Written communication, such as records, messages and giving evidence. Body language, which includes gestures such as arm or hand movements that underline what is being said. Facial expressions, reactions and feelings that support what is being said. Eye contact is key for showing you are listening and engaged in a conversation. Position, how we stand and hold ourselves. For people with specific communication needs, you may also need to use communication aids, such as sign language, recognised and used across the world, with some variations being specific to certain regions. Makaton, which uses signs and symbols, often to aid those with disabilities or impairments. Braille, a system of raised dots that enables people who are blind or visually impaired to read via touch. When you are talking with someone, you need to have a variety of skills. You need to know how to keep a conversation going, use listening skills to check understanding, organise a conversation, and use language that is appropriate to the situation.
Hello, Parkview Care Home. Catherine speaking. How can I help you? Right, no, of course, that's fine. I'll just make a note of that. Right, so just to confirm that Mrs. Evans and her daughter will be arriving today at 3 p.m. Right, of course, that's fine. I've made a note of that. And yes, I'll pass this information on to the afternoon staff and we'll make sure that we have a room all ready for her.
Without all of these skills, conversations and communication can be difficult.
Right, I'm going to start the tea rounds. I'll be back in half an hour.
Amanda, could you take Annie her daily paper as you're going to the lounge, please?
Okay.
Thank you.
Here's your paper, Annie.
Oh, that's not my paper, dear. That's Albert's.
Well, I was only doing what I was asked.
This interaction didn't go well. Amanda, the care worker, didn't check which paper to take and was also quite sharp with Annie when she informed her it wasn't the right paper. As an effective care worker, you need to ensure that your communication and listening skills are always positive and demonstrate respect for both the people you support and your colleagues. By not checking the information, this simple task has taken Amanda twice as long because she needs to go back for the correct paper. She has also left Annie feeling slightly upset by her abrupt response, which should never happen.
It was the wrong paper.
Well, all the papers are put on the table for the residents every morning, and the person's name is at the top of the paper. Oh, I'm sorry. I guess I should have said. I'll tell you what. I'll go and take this for Annie now, as I'm going to the lounge.
Okay.
Here we are, Annie, this morning's paper. I can see from the headlines that there are some things about the royal family in the paper today. I know you enjoy reading about royalty. That should be a good read for you today.
I should really enjoy that. Thank you, Catherine.
This is an example of Catherine using person-centred communication that values the individual and not just communication in order to complete a task. By mentioning something in the paper that she knows Annie will enjoy, she has made the task of handing her the newspaper a much more positive experience. Catherine's body language was also much more relaxed than Amanda's, the first carer, and this can have an impact when communicating. Body language and facial expression is such an important part of communication, and it should not be overlooked.
So you could see from that video the type of body language that's used within the element of, trying to make her feel welcome. What do you think that video identified? What do you think that video identified when it came to communication? How important communication is? Do you think it's identified the importance of communication? What do you think, Nancy? What do you think that video did?
It showed us how to pass the information from one person to another, like the nurse, the way she answered the phone and she took the record.
Yes.
Yeah, how to pass
Do you
on
think
to
it showed you why it's so why body language and facial expressions are so important, and to have this person-centered communication?
Yes, it did.
Well, for Amanda, do you think she did the person-centered? She did bad practice at the start, didn't she?
She
Because she was
did.
quite
She
rude.
did. Yeah, she was rude to the patient. The patient was like shocked to the way
Yes.
like she handled the thing. Like, what have I done to you? Or like that
Yes.
kind of impression.
Yeah. So,
Yeah.
having effective communication is really important because it identifies, the person's body language as well. Body language is a really important part. You can shrug or you can make a noise or huff and puff, and the person is able to identify. So it's really, really important to have effective communication and make sure you are doing things properly so that the patient is able to understand that you are communicating to them. So we've got communication and we've got different types of communication. So like they mentioned in the video, communication is really important when it comes to elements of sending or receiving information. In health and social care, it ensures that care providers understand their needs, their preferences and things like that. We've got types of verbal communication. There are some approaches that are used. Verbal communication is the one that was also mentioned in the video. And that's things like active listening, making sure you're concentrating, making sure that you are listening and you're fully concentrating on what the person is saying. Why is it so important to listen to the person and make sure that you understand that person and you're responding to ensure, clarity and that connection? Why is why active listening so important?
Yeah, because for example, now she took the wrong paper because she didn't listen who she's supposed to take the paper to.
Yeah,
So if she listened, she wouldn't make the first mistake.
yes. Yeah, she didn't really listen, did she? She just quickly took everything and
Yeah.
then was quite rude as well. Also, in verbal communications, questions that can't be answered with a simple yes or no, do more detail for them. Make sure you contextualize things, make sure you make them understand, make sure you just don't answer with a yes and no, and paraphrasing things and reflecting, repeating their words, what they're saying, making sure you're understanding what they're saying. Why is it important to repeat what they say?
It makes them know if you listen or you understand what's
Yes.
been said.
Makes them aware of what you're doing and you're listening to them and you're not ignoring them. Then
Yeah.
we have non-verbal cues. Now, non-verbal cues are the process of sending and receiving information through signals. Signals, it may be body language, it may be involving words, or it may be your facial expressions. So when we talk about body language and non-verbal cues, why are they so important, non-verbal cues? Your body language, what using your gestures, your body posture, if you're slouching, the way you're sitting, if you're tired, is the person going to feel like you're listening to them?
No.
No, no. So why is body language so important? What do you think? Why do you think body language is so important? What about touching? With it, why do you think touching, is sometimes it used, inappropriately, but most of the time it's used appropriately, and it could be things like, people want, people will want touch, touch, hugging, that's the way of, a handshake. But you've got to risk. That's why when we talk about these non-verbal cues, in some cultures, they don't like handshakes. They don't like, hugging. So you should respect every culture as well and try and understand each person's culture. Eye contact will show, that you've got an interest in that person and you're engaging and listening to that person. We then have written communication, which is a form of transmission of messages. It may be through emails, it could be through letters, it could be through the formal, record of interactions. It could be books, it could be social media, whatever you. And when it comes to health and social care, we have care plans in place, and these are written plans that outline a person's needs, what they need to do. If you have a care plan in place, what does why is a care plan so important? Why do you think a care plan is so important?
He explained and tells you how the person should be handled or why the person is in the care home, like what's wrong with the
Yes.
person, how to deal with the person, like how to keep the record, how to communicate with the person,
Their
what's wrong with
medical
the person,
history,
all
yeah, it
those
could be
needs. Yeah,
everything. It
yeah.
would be everything, and it would clarify any sort of elements of what their care needs are. Then you have medical records, which look at documentation of their past history, maybe their patient's health history and care, what medication they're, and information leaflets are really important for individuals. Maybe you give leaflets out on dementia or diabetes or anything like that that the patient would need to help them, and it's material that would support them. We then have technological communication, which is the use of digital tools and electronic tools, platforms, any way to receive messages. And it could be through texting, it could be globally, it could be, in fact, sometimes technology is good for some people, but not for all other people. You have electronic health records, which are now digital. Everything is becoming digitalized, so digital version of a person's medical history. Also, telemedicine, the use of telecommunication technology to provide clinical health. And I think there's something called patches that's the telemedicine one as well that people be able to use, and text or email reminders for appointments. And I think that's quite good actually, because when I get my reminders from my doctor, I appreciate that they've sent me a text message, and I think it works really well, because some people have this work-life balance where they're not able to always phone. So technology is a tool that is for communication and trying to connect people as well. Instantly. So it's there for the surgeries and the doctors to improve any sort of efficiency. I mean, I used to get letters through the post from my doctors. Now I get a text message to say, go onto this app, put your date of birth and your details in, and the letter will be there. So it's quite forward thinking. The only thing is, for certain people, technology is not the best. Elderly people, they don't tend to use it as much, so maybe it'll impact on them quite a lot. Then we have visual and oral communication, and this is images, and it could be symbols, it could be non-verbal cues, it could be speech, it could be sound, it could be, audio, like for people, for sign language, what was mentioned in the video as well. It could be the fact that, it's the way of conveying information for someone who has a disability or is able to, who's deaf or maybe who's blind. Pictures and symbols, care homes, anyone with learning disability, hearing aids for people with hearing impairments. And, it's really important for the hospital to provide these for the individuals, because, they need to have an ability to know what's going on as well. And these modes are provided for communication styles for different people. Then we have person-centered communication, and person-centered communication is an approach that looks at the individual's unique perspectives, try to understand their feelings, their thoughts, their experience. Acknowledging these kind of feelings is a person-centered approach, and allowing service users, obviously, or patients, to make their own decisions. They're able to have this empowerment and care to promote like shared understanding and empowerment. So making sure that they're able to do that, and then we have communication passports, which are used for individuals with severe communication difficulties, and these documents are a resource for individuals who have complex communication difficulties, who need support, and healthcare professionals would give them, and it would be an element of what the information is in there, maybe their key personal information. It could be their support needs, and it could be their likes and dislikes or anything like that as well. Group communication. Why do you think group communication is so important? Why do you think working in a group and having therapy groups and team meetings, why do you think it's so important? Does everyone in that group want to achieve a common goal, the same goal?
Yeah.
Yeah.
It helps them share their experience. Maybe they have the
ideas,
same
Yes.
ideas, same common difficulties.
Yes.
to achieve the goal that
They have a shared goal, don't they? They exchange information, they have ideas, they give each other feedback, they communicate like in a group, and they're able to share information, and interact with each other. And that's really, really important in these therapy groups. That people may have the same experiences they're going through. Team meetings, again, where professionals get together, put care plans in place. And the reason is, they need to communicate all this with everyone else as well. Cultural sensitivity and awareness, like we said, understanding people's needs, making sure you're able to understand their cultural differences, and the ability to understand without judging them. You need to understand what their barriers are to communication, how you can overcome them barriers. Confidentiality is really, really important. You can't share any sort of information. Make sure the information the individual's given you is not shared with anyone else, and it's kept confidential, especially with health and social care setting. You need to make sure that all information is confidential. Feedback, encouraging service users to provide feedback. What would they give you feedback on? What would service users or patients give you feedback on? What do you think they could give you feedback on, Nancy?
For what they're going through, or if they are kind of recovering, or
Could they give
how
you
they
feedback
feel.
on how to improve the service?
Yes,
Yes.
yes,
So,
yes.
it's really, really important to give you feedback on how to improve the service. It may be
Yeah, if
that,
there's something they know they seen as not
yes.
going right, so they have the right, they
Give me an
can
example
say,
of something they may tell you to improve.
um,
What about in a care
how,
home? Could it be like the facilities for dining or something, where they sit to eat?
yeah, they can how to arrange the chairs or how they sit. Maybe
Yes.
some of them they maybe want to face the TV, want to watch, or they want to face each other, or somebody want to sit in close to the other person to can
Yeah.
arrange the yeah.
Because, doing that for them would when it comes to effective communication, it builds this trust, this element of trust and understanding, and that person is able to understand that you are listening to them. So 1.1, explain the importance of effective communication. And we've looked at it, especially in health and social care, why it's so important, because it promotes this person-centered care. Ensures that an individual's needs are tailored to their preferences and their values. It enables this individual's experiences and make sure they receive, this personal goal that they have, make sure that they have and promotes this person-centered approach, making sure, your conversation with them is conveyed and tailored around what their needs are, what their feelings are, and what their values are, rather than doing it around what you are. Ensuring safety, making sure that, ensures that patients are safe. There's no mistakes made, there's no miscommunication made about any sort of medication. They're able to understand, they know, they can, any sort of errors around any sort of medication. It also builds this trust, working together, making sure you build this trust between individuals, making sure you have this relationship of trust, um, making sure individuals are valued and respected as well, and also that they're engaging with their care as well, and making sure that you have therapeutic relationships in place. Supports decision making, so making sure that service users have this accurate information, and making sure that you are putting decisions in place according to their needs as well. Another one is enhances team collaboration. So health and social care involve multidisciplinary approach, making sure your team members ensure everyone is on the same page. If you are working and then you come back and someone else is taking over, should you make sure you have this team collaboration and make sure they know that they're working well together and it's smoother. If someone's carrying on from you, Nancy, you need to keep them updated on what's been going on.
Yeah.
What if you don't do that? What happens?
That means the person maybe might be off for some days, and then you come back and you have you have changed the rules of how it's been happening and everything, and then the person didn't know what to do, so she might do the wrong things or
Yes. So in that instance, it's very important that you collaborate with them. Supports emotional and psychological well-being, so making sure that the social care can be stressful, making sure you're empathetic, your communication, and you're reducing any sort of anxiety, making sure that you are helping the individual understand and feel valued. Promoting health literacy, so proper communication helps ensure the person understands their health condition. So you need to avoid using any sort of jargon. You need to make sure you are clearly communicating things to them and making sure that you are, there's no misunderstanding, or how they can manage their care. Also respecting, again, cultural differences, making sure you're sensitive to ensuring that their cultural sensitivity, making sure you're taking into account their cultural beliefs, values, and practices, because not everyone will be, will be okay with things like, you know, for example, shaking their hands, or for example, hugging them. You know, why are cultures so important to take into account? Why should you take into account everyone's cultural needs? Why do you think it's so important to take into account everyone's cultural needs? Is everyone the same?
No, we are
So,
not.
sorry?
We are not. We all have
Yes,
different kind of
yes.
culture. Or,
Respecting someone's culture is very important, isn't it? And taking into account what their beliefs are. You know, there may be certain things. We live in a diverse culture, so, you know, often, you know, effective communication can be, you know, ineffective in certain ways because people may take it the wrong way.
yeah.
You know, and there are barriers to communication. Is one of them is culture. One of the things, facilitate informed consent. Before any treatment or intervention, service users must get informed consent, and this can help them effectively communicate any sort of treatment. Reducing conflict, and this is another one. Make sure there's no misunderstanding, to reduce any sort of conflicts, and make sure service users are, you know, there's no conflicts between any sort of team members or anything like that as well. Again, enhancing privacy and confidentiality, making sure there's proper communication protocols in place, that sensitive information is shared with others. Why is enhancing privacy and confidentiality so important in any aspect? Why is it important to maintain privacy and confidentiality? Latifa, too? Why is it important to maintain privacy and confidentiality?
Yeah, it's important to do because you know the privacy of the patient or the individual is important.
Yes.
Yeah, yes. So
And
you need
any
to respect
confidential
that. Yeah.
information can't be shared, can it? So you need to
Yes,
make sure.
can be shared so to know that the person is safe and the person is trusted.
Yes,
Yes,
yeah.
yes.
So it's really important in them aspects. Supports continuity of care. So when there's a need for handover, whether between shifts or between different care settings, effective communication ensures next set of care workers. So, you know, making sure you supported them as well. And, you know, effective communication is the main thing, the cornerstone of any sort of health and social care, to make sure that there's elements of, you know, safety and trust for that individual to be able to open up to that individual as well, and making sure that, you know, they feel in control, but they feel comfortable telling you things, you know, and the easy, you know, making sure that they're able to look at any sort of elements of, you know, you have, you know, people making them feel comfortable about anything that you're talking about, making them feel like, you know, in having this person-centered communication will make them feel like they can tell you things, that they're in control of their own feelings, and you develop this connection and this rapport with them. So we've finished learning outcome 1, and these are the references we've used today, so you can have a look at them in your own time, and there's some links there to the references as well, and they're quite good reading for you to do. So just to give you a summary of what we've done in learning outcome 1, we've looked at understanding communication approaches used in health and social care. We've also looked at what the reasons are for communication and why they are so important. We looked at elements of effective communication in health and social care, and making sure that we've looked at elements of what communication is in general. We also looked at verbal cues, verbal communication, things like spoken words, written words, active listening. We also looked at non-verbal communication, which is things like body language, facial expressions, gestures, eye contact. And then we went on to looking at written communication, which is things like, you know, care record plans for health and social care, any sort of emails, letters, any sort of, you know, medical records. We then went on to look at technological communication, which is things like, you know, the use of technology, text messages, voice activated devices, any sort of mobile technologies. We finally went on to visual and oral communication, the process of getting visual elements across, like graphics, maybe symbol conveying things for blind people, for deaf people, providing these resources. We then went on to look at what a person-centered communication is, and also looked at communication passports. And we looked at group communication in reference to therapies and things like that, and why they all have a shared common goal. We then went on to look at cultural sensitivity, and why it's so important to have communication, and why communication is so important in health and social care. Things like, you know, making sure that you're able to understand the individual, making sure that you're able to identify what the communication needs are, you know, and what their cultural needs are in respect of that. So these are the resources we've used. Preliminary, please refer to any ebooks and journals on the Moodle for this unit. Any sort of further reading is available on Moodle that you can help you understand certain concepts. Communicating with people with a learning disability is a link there to it, so you could have a look at that on MenCap website. Also, 3 must-have communication skills. There's another link there, and you can right-click that, and is a resource for you to have a look at. Any sort of questions or anything? Has anyone got any questions that they need to ask? Anyone got any questions?
Yes, please. Are you going to send the recording on the group or on the Moodle?
No, the recordings will be available for you on Moodle.
Oh,
They will be available for you on Monday when you've done the other session as well.
okay. All
Okay,
right.
so that
Thank
will
you.
all be available for you. Every session we do, the recordings will be available for you, okay?
All right. Thank you.
So has anyone else got any other questions before we finish the session? If you have any questions or any sort of queries, please email learnerwork@ukvarsity.co.uk, and any sort of submission of your assignment, which we'll discuss in the 4th session, will be done on learnerwork@ukvarsity.co.uk, okay? Any questions, please email. Thank you for attending today's session. The next session is tomorrow at 1 o'clock, which I'll see you all in that session. Thank you.
Thank you.
Thank you. Have a nice day.
You
Thank
too.
you.
Thank you.
Take care. Bye.
Bye.